Welcome to Eye Contact, a video news program on issues and controversies in ophthalmology sponsored by EUROTIMES. I'm Dr. Soosan Jacob. The annual ESCRS Congress is a favorite of young ophthalmologists as it provides a great variety of courses, clinical updates, not to mention social activities. This includes sessions tailored specifically for the young ophthalmologist. But what exactly do young ophthalmologists want? We're going to discuss this with Dr. Leigh Spielberg, who completed his residency training and vitreoretinal surgery fellowship at the Rotterdam Eye Hospital and is now a vitreoretinal and cataract surgeon at Ghent University Hospital, Belgium. Welcome, Leigh.
Thank you.
Learning surgical skills is the steepest hill we have to climb. What do you think helps a young doctor through the stage?
I think the first steps that a young ophthalmologist has to take are steps taken at home with his own books. Getting a very good grasp of the anatomy of the eye, the physiology of the eye, having a good relationship with a mentor, someone who you can trust to help you through the surgical training, getting a good feel in the operating room itself for the equipment, practicing with the microscope, practicing with the equipment, knowing where everything is in an operating room, and really making the operating room your own. Those are sort of the steps. Also a continued dialogue with the mentor and continued research into what the new developments are in surgery so that you really feel comfortable and up to date when you enter the operating room.
Right. I think those are very good points. So you spoke about the mentor. How important is the role of a mentor?
I think the more involved you are with a mentor, one or multiple mentors in your training hospital, the better. The mentor is someone who you can trust with your sort of surgical anxieties, someone who you feel comfortable with interacting. I think a resident tends to want to have a mentor who is very approachable. Someone who maybe isn't out of training for too long, someone who's maybe been an ophthalmologist for, let's say, 5 years, who still understands what it is to, be in the operating room for the first couple of times. Someone who has a sense of humor, because it's a very stressful period, learning, for example, cataract surgery, and someone who's very open to dialogue, both in and outside of the operating room.
I think that's very true, Leigh, especially the points about having someone whom you can really approach easily, maybe someone not too old, not too established in the profession, but someone to whom you can easily relate to.
Absolutely.
That's great. So how best can we help each other along the way?
I think within a training program, every resident has his or her own strengths, weaknesses, speed at which he or she will learn surgery. I think that sort of that appreciation of each person's strengths and weaknesses, sort of anxieties as well, makes it a sort of a comfortable learning situation so that everyone feels comfortable, and that will speed along everyone's development.
So Leigh, if a young medical student told you he or she wanted to study ophthalmology, what would you tell them?
I would tell them that they are making a very good choice. I have been very happy with my choice since I started quite a few years ago, and I haven't looked back. It's a field that is continually on the cutting edge of both science and technology. You have a very involved industry that's always looking to sort of help the surgeon achieve the best possible outcomes. It's also a very broad field. Most non-ophthalmologists think that the eye is so small, it must be very limited. But as we know, it's a vast terrain with a lot of surgical options, medical options, a lot of patient interaction. You can help everyone from babies with retinopathy of prematurity up to people who are 95 with a dense cataract. So it's a lifetime that you can treat a patient. The relationships that you have with the patients are very satisfying, and you really can never know it all, so it's sort of a lifetime of learning. I think most of the ophthalmologists that I know are very happy with their choice, and almost no one regrets their decision to go into ophthalmology.
I think that's very true. The thing that you said about the little eye, the small little eye having so much to itself, each part having such vast diseases, technologies, specific technologies, specific new drugs coming up, and so many things that it's really amazing how much there is and how much we need to keep up. And I think that's part of the fun in it, the pleasure of always having to learn every single day going on and learning more and more new stuff. That's great.
Yeah.
So thank you for joining us, Leigh. And for more information on this and related topics, please visit us at eurotimes.org.